Hi guys, welcome back to SG Dr. Wellness. In the last episode of this STD series, I will share more about herpes simplex virus. Are you aware that almost half of the world's population has this virus? What are the symptoms and treatment for this condition? Subscribe now if you're new to the channel. Herpes is a familiar sounding condition to you, I'm sure. This is an infection that is caused by the herpes simplex virus that is very contagious and often spreads through human-to-human contact. The herpes simplex virus family has two members, HSV1 and HSV2. HSV1 is mainly transmitted through oral-to-oral contact, causing oral herpes, commonly known as cold sore. HSV1, however, is not limited only to oral herpes, it can also cause genital herpes as well. HSV2 is a sexually transmitted infection that causes genital herpes. These are mild infections that are generally harmless but may lead to potential fatal complications for newborns, pregnant women, and those with weakened immune system. An estimated 3.7 billion people under the age of 50 have HSV1 infection globally, and that's about 67% of the human population. An estimated 491 million people aged 15 to 49 worldwide have HSV2 infection. So it's a very, very common condition. So let's zoom in on HSV1 first. HSV1 is not technically a sexually transmitted infection. Transmission occurs mainly via contact with the virus in sores, saliva, or surfaces in and around the mouth. So kissing and sharing of utensils are some of the common modes of transmission. The greatest risk of transmission is when there are active sores appearing. Most HSV1 infections are acquired during childhood and not uncommonly from our parents. Oral herpes infection is mostly asymptomatic, but when symptoms do occur, it can be very uncomfortable. Infected persons often experience first a tingling, itching, or burning sensation around their mouth before the onset of these painful sores or vesicles. The sores will resolve on their own usually within 7 to 10 days but can recur periodically throughout our lives. Other common symptoms of HSV1 infections include fever with muscle aches, lymph nodes swelling, swollen red gums. What about HSV2? HSV2 is mainly transmitted during sex through contact with genital or anal surfaces, skin, sores, or fluids of someone infected with the virus. It can be transmitted even if the skin looks normal and in the absence of symptoms. Genitalia herpes can be asymptomatic or have very mild symptoms that can go unrecognized. When symptoms do occur, one or more painful vesicles or ulcers may appear in the private area. Again, it may be preceded by pain, itching, or burning sensations. Other symptoms of HSV2 infection can include also fever with muscle aches, swollen lymph nodes. These symptoms can resolve, but with HSV infections, they can recur periodically. Herpes simplex virus infection is usually a clinical diagnosis made by the doctor. No tests is necessary. However, if sores are noted, this can be swabbed and sent to the lab for microscopic examinations, viral cultures, or PCR testing. The treatment objective for HSV infections are actually 1. To reduce the severity of the symptoms, 2. To speed up the healing process, and 3. In patients with very frequent recurrence, to reduce the frequency. Unfortunately, once you have HSV, you cannot be cured. The virus stays with you. Therefore, to avoid spreading this virus to others, those with active oral herpes should avoid oral contact with others and avoid sharing objects that touched the saliva until symptoms have fully resolved. Individuals with genital herpes should abstain from sex until symptoms have resolved fully too. However, given the fact that HSV can be transmitted even when no symptoms are felt, avoiding promiscuous sexual activities and using condoms are some other ways to reduce HSV transmission. Now, I would like to highlight two important points about HSV infections, which is its relation with HIV and transmission of HIV from mother to child during delivery. HSV2 infection increases the risk of acquiring HIV infection by approximately threefold. Additionally, people with both HIV and HSV2 infection are more likely to spread HIV to others. Therefore, it is recommended to screen for HIV infection when someone has been diagnosed with HSV2. In rare circumstances, herpes simplex virus can be transmitted from mother to child during delivery, causing a condition called neonatal herpes. It is rare, but when it does occur, can lead to serious consequences such as death to baby, brain infections with permanent neurological disability to the infant, and even eye infection with potential blindness. Therefore, if you are pregnant and have symptoms of genital herpes, please inform your obstetrician right away. Thanks for staying till the end. I hope this episode has increased your knowledge to one of the most common viral infections in the world. Recognize its symptoms to prevent the spread to your loved ones. Subscribe, like and share. Until the next time, stay safe, stay healthy.